Okay, so today we are in the med room. We are preparing medication for Mr. Spider-Man here. He has high blood sugar and he gets 5 units of insulin. That's the order. And so we're in the med room. We're going to prepare that insulin and get it ready for injection. So the first thing we're going to do is verify the order in the EMR and make sure that our medication comes out correctly. It is regular insulin. It comes in 100 units per milliliter. There's 10 milliliters. So my first check, right dose, right time, right patient, right medication, and right route are all there. We're going to do it sub-Q, and it is for Mr. Spider-Man. Before we get started, we're going to clean the area. So I have some wipes here because I like to have things clean. And then before we start, we're going to do hand hygiene. I'm going to put on some gloves because I like wearing gloves. Now I'm going to take my alcohol prep pad, rip it open, and I'm going to wipe the top of this for about 10 to 30 seconds. Get it all nice and clean because we're going to stick a needle in here and that needle is going to go in the patient's arm. So we want to make sure that this is not going to have any pathogens or bacteria on it that could go into a contaminated area. Okay, now we're going to let that dry. I'm not going to blow on it. I'm not going to wave it because that could spread pathogens. Since today we're just doing regular insulin, if we were going to do a mixed insulin, then we would perform the Nancy Reagan registered nurse method, which is where you aspirate NPR and then aspirate regular and then withdraw regular and withdraw NPR. In this case, we're just doing regular, so we're going to aspirate our 5 milliliters of air into the vial and then withdraw 5 units of regular insulin. Since this is a needle, you got to worry about needle sticks. So what we do is OK method, separate like this. I'm going to take my needle and I'm going to go straight down into the vial now that it's clean. And then, oh my gosh, I'm going to have to edit that. Okay. So I'm going to do the OK method. So I'm going to withdraw. I'm going to aspirate 5 units of air. And then I'm going to go straight down into the vial. And I'm going to push the plunger in. Now I'm going to turn upside down. And I'm going to withdraw 5 units of regular insulin. I'm going to make sure that there are no air bubbles. I believe this is the first time I've ever done it where there are no air bubbles. If there were, I could click it and get the air bubbles to the top and then withdraw or aspirate as needed. In this case, I have 5 units of insulin through the top. So I'm going to take the vial and I'm going to do my single-handed swoop method to, let me move this closer, to get the cap back on. So it's on there. I'm just going to push it on. Now I have a prepared dose of insulin for the patient. So I would take off my gloves, perform hand hygiene, and I would document and label this because I'm going to carry a needle. I would also take the vial with me if I needed to. And I would wrap tape around this and make sure that it has the patient's name, date of birth, what the dose is, what it's for, and just basic documentation. So now that I have my needle, I'm going to carry it to the patient's room. And before I go in the patient's room, I'm going to do my second check and make sure that this is what it is intended for. So I'm going to do my 6 R's. I'll repeat them again. Route, time, dose, medication, the right patient, and then I'll document it later on. So I do all that. It is right. So then I go into the room and I say, hey, Mr. Spider-Man, I'm here to give you your insulin injection. I have 5 units of insulin. And before we get anything done, I'm going to make sure you are who you say you are. So I'm going to do hand hygiene. And I'm going to say, Mr. Spider-Man, could you please provide me your name and date of birth? It says his name is Spider-Man Jones. His date of birth is January 15th, 1986. And I say, Mr. Spider-Man, do you have any allergies that we need to be aware of? He's not allergic to anything, so that's great. Very helpful with that. I say, Mr. Spider-Man, we have to administer your insulin because you have high blood sugar. And so in the past, where have you administered your sites? We have different sites available. We have our arm here, our deltoid here. We have our hip area here. We can also do it on the thigh, or we can do it on the abdomen. Mr. Spider-Man says, I usually do it in my abdomen because most patients do. So, okay, so let's, which site did you do it last? So Mr. Spider-Man said he did it on his right abdomen area. So we're going to do it on the left abdomen area. If we were going to do it on the deltoid, we go 3 fingers down from the AC joint, acromial joint. We go 3 fingers down and we form our V. If we were going to go here at the hip, then we would go 3 fingers down from the iliac crest and we would form our V and we would stick our needle right in there. In this case, we're going to do our thigh. Or no, let's do our, since he did the right abdomen, we'll do our left abdomen. This is a sub-Q injection, so we would do 90 degrees right into it. So I would prepare the area for Mr. Spider-Man. I would lay him supine, and we would clean the area. And we would clean the area with an alcohol swab. And say, there you go, Mr. Spider-Man, and clean this area. Let that dry. And then in this case, Mr. Spider-Man cannot be stuck, so I have an orange here. I would then get my needle ready. I would say, okay, Mr. Spider-Man, I'm going to stick you with 5 units of insulin. Whenever I get ready, I'm going to, I could do 2 methods. I could pinch the area here, bring it up, or I could also do the slide method, which is where you slide the fatty layer over and then stick it in. In this case, I'm just going to pinch it up. And so I'm going to withdraw my area. I'm going to pinch the area up, and I'm going to go straight in at 90 degrees. So stick it and shoot the medicine in. Let it out. And then I'm going to do my swoop method again to cover my needle. And then I'll place this in the sharps container here. And then I'm not going to aspirate the wound. I would put some gauze on there. If there is if some blood is present, I can tape it up, put a Band-Aid on there, Spider-Man Band-Aid if I wanted to, and say, thank you, Mr. Spider-Man, for letting me inject you with some insulin. Perform my 5 nursing priorities. If he has the right, if he has medicine or water, right position, I would lower him down in his bed if I needed to, get his call light available, have water there, make sure he doesn't need to go potty, and thank him for letting me come into his room and sticking with a needle. So that is my needle stick. Thank you for watching. Oh, hand hygiene, and I would be out.